Okay, we're going to talk about immunostimulants. Remember that your red blood cells and white blood cells are important in terms of protecting your body from infection. So when we are dealing with clients that are in disease states that cause a change in the production, or maybe they're receiving chemotherapy that's actually destroying red blood cells and white blood cells, then the development of these drugs actually helps to stimulate um, hematopoiesis and immune function. So these drugs help to restore normal function and boost, if you will, the immune system. The first group we're going to talk about is the epigen. Um, so let me go back and remind you about what is erythropoietin. You should have covered this in A&P. It's a hormone secreted by the kidneys, and it helps to stimulate red blood cell production. Now, there are certain conditions that automatically, naturally, will help produce red blood cells. For example, hemorrhage, anemia, COPD, because your body is experiencing hypoxia. So it thinks since the hemoglobin on the red blood cell is responsible for transporting oxygen, it's just going to produce more of it, even though it doesn't really help. And then high altitudes. So the prototype here is Epigen. So we use Epigen to prevent and treat anemia associated with chronic renal failure, certain liver diseases, chemotherapy, as well as anemia associated with HIV. Nursing implications. This is a very dangerous drug, so as with all drugs, we want to give the lowest dose possible to get the effect that we need. This is especially true with this drug. This drug is contraindicated in uncontrolled hypertension. It also is associated with thrombosis and hypersensitivity reactions. In terms of nursing implications, then, we want to assess the blood pressure in relationship to thrombosis. We want to assess for signs and symptoms of DVT, MI, stroke. And the incidence of thrombosis is directly related to the increase in hemoglobin levels. So there's a fine line here between achieving the therapeutic intent, which is to increase red blood cells, and doing it too quickly and going over a hemoglobin level of 11 grams per deciliter. Now your book uses the value 12, but I've done some further research on that, and we're going to use 11. So it is important that the nurse monitor hemoglobin levels, watch for sudden increase, and notify the physician when it's approaching 11 grams per deciliter. In terms of indication for use, the drug is not indicated unless the hemoglobin falls below 10. And let me say another thing about the thrombosis. Again, remember, if you're at risk for DVT, you're also at risk for pulmonary emboli. So we do want to, these are chronic conditions that the patient is receiving these drugs for. They may or may not be hospitalized. So you are going to want to instruct them on symptoms of MI, DVT, stroke, so that they can report that to their primary care doctor. So what are they looking for? They're going to be need to know that they need to report any chest pain, any trouble breathing or shortness of breath, any kind of pain in their legs or even swelling. Also, if they start to exhibit signs of a stroke, which would be confusion, changes in speech, weakness, drooping of the one side of the face, Those are all important symptoms to report. Keep in mind that if this patient is receiving the drug for kidney failure and it's being administered for that reason, it should be administered at the end of the dialysis treatment. The other important fact for patients to consider in terms of if they're receiving it for anemia associated with chemotherapy, it may actually stimulate tumor growth. So there is a specific protocol for administration of the drug for patients who have chemotherapy anemia. Oncologists or primary care providers actually undergo a program to inform them of standards of practice in terms of prescribing. Other important factors to consider in terms of nurse administering the drug: it can be administered, or it is administered sub-Q. If it's in a multi-dose vial, it should be discarded after 21 days. It is important that the vials be refrigerated and that they be protected from light. They also need to be inspected for any kind of particles. These drugs are also administered IV. Another drug that we see in this drug class is Neupogen. It is used to stimulate white blood cell production. So we see it being used following bone marrow transplants, as well as neutropenia secondary to chemotherapy. Adverse effects include fatigue, flu-like symptoms, nausea, bone pain. It can also cause splenomegaly, which is more common in children than adults. And it also can cause a condition called ARDS, acute respiratory distress syndrome. A couple of things to keep in mind in terms of nursing implications is that do a good health history. Sickle cell anemia is actually contraindicated with administration of this drug. Do not give within 24 hours before or after chemotherapy. This is a drug that's usually given daily, so you need to, obviously, the person needs to be aware of when their chemo treatments are going to be scheduled. It's administered sub-Q or IV, and for both of these drugs, the Epogen and the Neupogen, caregivers can be instructed to administer at home. Again, don't shake the vial. Acetaminophen can be given for bone pain. However, the patient should be instructed if this is not effective and the bone pain persists, that should be reported to the primary care provider. This drug helps to protect against infection, but it's not foolproof. So the client should be instructed to report any signs and symptoms of infection. Obviously, we're going to be looking for that as well. You're going to be monitoring platelet counts and white blood cell counts to determine effectiveness. The drug will be discontinued if, the white blood cell counts are achieved within therapeutic levels. Another important point that you want to teach is upper right quadrant pain that may indicate that the client is experiencing splenic rupture. Did I say right? I meant it should be left upper abdominal pain or shoulder tip pain. Left upper abdominal pain or shoulder tip pain. Both of those may be indications that the spleen has ruptured, and that needs to be reported immediately to the healthcare provider. Then the last thing that we're going to talk about is interferon alpha. These have both antiviral and anti-neoplastic activity. I've listed several indications for use. I've seen it used primarily for chronic hepatitis C. This drug works by stimulating, again, the immune system. They're not really sure exactly how it works, but they do know that it helps to slow down or stop cancer cells from dividing. And it also helps to strengthen the immune system. Adverse effects, again, are flu-like symptoms. In terms of nursing implications, the drug should not be administered to anyone under the age of 18. You need to observe for symptoms of liver disease. It can be administered IV, sub-Q, IM, or intralesionally, which is within the lesion itself. It's important that it may be maintained on a regular schedule. It's usually 3 times a week. Observe for liver function tests because it may elevate liver functions or liver enzymes. Also, you'll be monitoring platelet counts, white blood cell counts, and red blood cell counts.